The virus hasn't changed. The way you get infected with the virus hasn't changed. The biology hasn't changed. What's changed are the way that we're seeing this disease play out in the population.
I'm Ante Padjen, and it's my pleasure and honor to introduce this first virtual concert of Medici di McGill. As in last 32 years, we dedicate many of our concerts to some good cause. And today we are dedicating our concert to our colleagues and students engaged in research and management of COVID-19 as members of McGill Interdisciplinary Initiative in Infection and Inflammation in Immunity, MI4. We are very fortunate to have Dr. Don Sheppard, founding director of MI4, for a little conversation about COVID-19. Well, can you give us a snapshot of where we are right now in this outbreak?
Thank you very much. It's really a pleasure to have the opportunity to chat with you today. I think we all recognize that we're in a scary place right now with COVID-19. Numbers around the world are rising in multiple countries. There is we're probably in the second wave in many places, and Quebec and Montreal are no exception. The daily numbers have been going up. We're now over 300 cases a day. So it's realistically wave 2. But it's different somehow. The virus hasn't changed. The way you get infected with the virus hasn't changed. The biology hasn't changed. What's changed are the way that we're seeing this disease play out in the population. So in wave 1, we had a high hospitalization rate, high mortality, and it was a bad disease in Quebec. And that's because it got into our long-term care facilities, and it got into elderly populations where those people were more susceptible. And now what we're seeing is, even though case numbers are rising, hospitalizations are going up very slowly, ICU rates are going up very slowly, and around the world, and here in Quebec, the mortality rate has gone down dramatically. And that's for a couple of reasons. The first is it's circulating in the community amongst healthy young adults, and their rate of complications and need for the hospital is much, much less. The other thing is we're testing aggressively, and much more so than in the first wave, and so we're finding a lot of mild asymptomatic and non-symptomatic diseases. And lastly, from the point of view of mortality, we actually have some new therapeutics that are reducing the mortality rate with this condition.
So what are the therapeutic interventions that we have right now? And what is the future prospect of some really effective therapeutic agents or procedures?
Well, right now there are 3 big agents available that are coming into use around the world that we think are having an effect on mortality. This is aside from general supportive care, which we do all the time in our ICUs and our hospitals. The first is, of course, dexamethasone, which many people have heard about, which is an anti-inflammatory and seems to reduce the death rate by as much as 1/3. Then there's the antiviral remdesivir, which is of illness and probably the severity as well. And lastly, there's a recognition that clot formation isn't part of this disease, and that clots forming in the lungs are part of why patients get so sick. So the use of anticoagulation or blood thinners has also had an effect on death rates and severity of disease in our hospitalized patients. What's coming down the pipe? Well, I can tell you that there are several hundred agents in either early or late testing, everything from antivirals to antibodies to things that manipulate the host immune, and some of them are looking very promising. I'm part of the Canadian COVID Therapeutics Task Force, and we are looking with members of the government to identify which of these agents are going to likely pass the finish line and be winners, and how we can secure adequate quantities for Canadians.
Well, we are now in the 6th month or past 6 months of this pandemic, and many people really are pretty well in COVID-19 fatigue. What is the exit strategy, if any?
Well, I think there's a couple of exit strategies. Let me first talk about the one that is in the news these days, and that's changing the way we use testing. So there have been two real advances in testing. The first is the recognition that saliva testing is probably as good as the horrible nasal swab, where it feels like somebody's trying to sample your brain with this swab. And everybody hates that. Nobody wants to get it. That's a big barrier to getting people tested. And obviously, the more we test, we find, the more we isolate and can interfere with disease spreading. So using saliva test, just putting it in the mouth, if that gives us a good result, that's huge, because nobody minds just having a swab in their mouth, their nose. The other big change we're seeing are these what we call antigen tests. So these are tests that are not looking for the nucleic acid, the genetic code of the virus in a fancy hospital lab, but they're using little kit type of testing things that you could do at home, you could do yourself, and it would give you the result within 10 to 15 minutes. If we had those available, we could roll those out so that you could know at any given time, is anybody contagious or not? So imagine how this could be used in travel, in the workplace, in hospital systems, where we could know within 15 minutes whether someone is or isn't contagious. And if we can move some of those early prototype tests that have had preliminary licensing in other countries to risk-sensitive kits that we can use here in Canada, that's a way to change the game in how we manage this outbreak.
What's the situation with vaccines? So much discussion, so many kind of leads, but where are we right now with vaccines?
So that's the other exit strategy, and that's the holy grail that we're all hoping for, a magic vaccine that's going to protect everybody, that we can all get and be done with COVID. So obviously, there's a lot of activity here. There's over 100 vaccines in various stages of trials, over a dozen in clinical trials, late stage clinical trials. And I would say at least 4 vaccines that look like they are got a decent chance of making it across the finish line. When is that going to happen? Unfortunately, without a crystal ball, no one can tell you whether it's the end of November, the beginning of January, but I think we can safely say we will probably have a vaccine to deliver to Canadians within as a maximum, the first quarter of next year. The government has set up a vaccine task force to identify which of these vaccines are the most likely to be effective and to pre-purchase quantities. There's efforts going on to identify how we can have enough syringes, needles, rollout strategies, public access strategies to get the vaccine to people. But it's going to be important to recognize that on day one of this being available, we're not going to walk out and vaccinate the population. There's going to have to be a staged rollout. Have to look at giving it to the highest risk people first, and to the people who are working in high-risk situations like healthcare workers and frontline workers. And it will roll down over time until we're giving it to healthy 18-year-olds like my children. And that's not just because of vaccine availability, but that's balancing risk and benefit. If you're a 75-year-old person working in a high-risk setting like a healthcare facility, you want the vaccine because if you get COVID, your chance of death is not inconsequential. So you can handle any risk to a new vaccine that hasn't been given to millions of people. But when we start giving it to healthy young adults, we know that their individual risk of a bad outcome is very, very low. So they're getting the vaccine in many ways for the rest of us. And we want to make sure then that we are giving them the safest vaccine possible. So that means we want to have some experience before we roll it out to 1 million young Canadians.
How about flu vaccine right now?
So I think, people should proceed with their flu vaccination like always. We are trying to increase the quantities we have available. The good news is that wearing a mask, keeping 2 meters of social distancing, working at home, and all of the things we're doing for COVID, it's a really good way to not get influenza as well. And so we're hoping for the best flu year in recent memory.
Well, something about MI4, you launched MI4 in 2017 to help tackle the infectious diseases, which are still menacing our civilization, so to speak. And of course, threats like COVID-19. What has been MI4 and McGill's response to the pandemic?
Well, when I went around telling people that we needed MI4, I said, the next pandemic is coming. And there are times I wish I could eat those words. I certainly didn't expect it to be quite this soon. But in many ways, our efforts paid off because we had positioned ourselves to be ready to act. And we tried to be nimble and effective and impactful with this large intellectual capital we have, which is McGill's academic community. And I think we've been really successful. There are sort of three major things that I think we did very early in the outbreak that have come to fruition. And when I say early, understand that we saw this coming. We actually had our first call for action to our community in late January before we had any cases here in Canada. So the three things we did were we invested in 2 research platforms and in a series of innovative seed projects. And the 2 platforms that we funded were, first of all, a clinical trial to rapidly bring clinical trials to people in the McGill healthcare system so that everybody would have access to a clinical trial. And remember, when you have a disease where there's no treatment, the only way you're potentially going to get one is to offer clinical trials. And that worked really well. We running dozens of trials of vaccinations, plasma transfers, and that was up and running during the first wave and is up and running now because we invested so early. The second big thing is our level 3 lab, our biocontainment lab, or hot zone, where people get this virus safely. Because you can't just do this on a benchtop. It's a level 3 picture, spacesuits and airlocks and all that good stuff to be able to work with them. So we had one of the first Public Health Agency of Canada certified level 3 labs to work with coronavirus, to do the test tube work, the animal work, to develop new treatments, new diagnostics, and new vaccines. And we're supporting dozens of research projects and companies to move therapies forward in this space. And then the third part of this tripod was the actual research itself that we kickstarted. We put out a challenge to our researchers and to our community to give us their best ideas that had an impact in less than 6 months and that were going to change the game. And our community responded with several hundred proposals, over 50 of which we've supported, are up and running and have been since March. They're already paying dividends with new diagnostic test kits, new strategies, with advice to the government, with advice on dealing with public health measures and mental health. And the thing that we really are proud of with this is that this was the disciplinary eye in MI4. We didn't just want people to be playing with test tubes and trying to find new antivirals. We wanted people to look at the legal aspects to public health measures, to ethical aspects, social issues with the economy, with closing down schools, with distance learning, with mental health from professionals who are dealing with burnout, dealing with isolation, to tap into the wealth of the academic community that McGill has to offer. And indeed, that's what we got. And some of those have been really fascinating to read.
Well, and what role are you playing in the larger Canadian context?
So because of our early McGill academics have actually had a big role in shaping the Canadian landscape. I've already mentioned the Canadian COVID Therapeutics Task Force, of which myself and 3 other McGill members are part of the Scientific Advisory Board. We have people who are consulting and doing modeling of the outbreak to the provincial and federal government. We have, McGill was actually the source of the energy and the launch of the COVID Immunity Task Force, the Canadian COVID Immunity Task Force. It houses the Secretariat. One of the co-chairs, Kate Hankins, and the head of the Secretariat, Tim Evans, is also here at McGill. They're the front lines, charting the policy, roll out testing, looking at and trying to end this pandemic.
Well, thank you very much. We wish you much success in these efforts, and we hope the next installment will be much more optimistic.
Thank you very much, and everybody stay safe.
Thank you very much.
Thank you. Thank you.